Order. Ladies and gentlemen, please rise for the Pledge of Allegiance. I pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good evening, everybody. I'm Ed Weiner, and I'm chairman of the Burlington Board of Health. To my right is David McSweeney, who is vice chair of the board, and I have two members this evening, Dr. Wayne Saltzman and Andrea Sheehan. Mary Beth Welch could not be with us this evening. In addition, I have the Director of Public Health, Susan Luminello, and our environmental engineer, Christine Mathis. And do we have online Dawn Cathcart, our recording secretary? No, she is not on this evening. Citizens' time. Is there anybody, actually approval of minutes. We have no minutes to approve this evening. Citizens' time. Is there anybody here who is not on the agenda who would like to speak to this board? Is there anybody online? Ms. Luminello, do you see anybody?
We have some people online, but if they could unmute themselves if they'd like to speak.
I guess
I
not.
don't see anyone.
Okay. Chairman's report. We as a board are so happy to be again live this evening. And thank you to BCAT for televising this meeting and for all that you do to keep this community so well informed. And I also want to acknowledge our professional staff here tonight and those who are in our office. They've been so busy over the past weeks. I want to thank all of you, all for your hard work and commitment to this town. I also want to thank our elected board because they have been just as busy. Now this, once a month, or only a month ago, we thought the COVID pandemic with vaccinations and precautions was under control. But it looks like with a new variant, it will be with us for some time. Many, even vaccinated, are still getting sick. Hospital admissions are on the rise, and sadly, there are still deaths due to this variant. I know vaccination is a personal choice. I know even in the face of full approval today, for some it's a symbol of their freedoms. But I urge those of you that have not yet been vaccinated to think about what you mean to your family and friends. They and we of this community want you well, and we want you alive. The shot works. Please think about becoming vaccinated. The Board of Health is always here to answer your questions. Just talk about the pandemic and the vaccine, and feel free to call our office anytime. Yes, we're all here for you. As always, I open this discussion for comments from my colleagues if they'd like to make any comments this evening. Okay. Do we have Mr. Larkin on?
Yes, we have Patrick Larkin and Dr. Conti are both on.
Okay. Tonight, we are honored to have with us Mr. Patrick Larkin, who is the Assistant Superintendent of the Burlington Public Schools. And you said Dr. Conti is also with him, our superintendent. And they have agreed to update us on school preparedness. And since they have other obligations, I'm going to ask for a motion to take school update COVID-19 precautions listed under discussion out of order. Could I please have a motion?
So moved.
Second.
I have a motion by Dr. Saltzman, second by Mr. McSweeney. All in favor?
Aye.
4-0. I'm going to call upon, I'll call upon a Director of Public Health to lead this discussion.
Sure, okay, so I had met with Patrick Larkin and Barbara Conley, the nurse leader. Yesterday, we had discussions about a joint memo that had come out just recently from DPH and from DESE with suggestions or recommendations for the school year. This is something that the school is working on. And as you all know, well, prior to when we put him on the schedule, there was no requirement for masks in schools. As you all probably know today, there is now a requirement for masks in all schools in Massachusetts, and they can talk a little bit more about that. But I'll let them talk about the masks if they want to, and the just what they're working on now in light of this memo from DESE and DPH for school reopening. So Patrick, I don't know if you want to start? So they both are on mute.
They can't hear you, Jen says.
They can't hear us?
She just texted and says, let Susan know they can't hear her.
Patrick, can you hear us?
Yes, now I can.
Oh.
I couldn't hear anything prior to when you just asked me that question.
Okay, so I just kind of gave them an overview, let them know about our meeting yesterday, about the joint memo from DPH and DESE, and how we talked a little bit about masks. No longer as much of an issue now that the state has said that all children in schools need to wear masks. I believe it's until October 1st, correct me if I'm wrong on that. But I thought maybe you could just give them an overview of what the schools are working on now in light of this joint memo and some of the things that we talked about yesterday.
Sure. Thank you, Susan, and thanks to the Board of Health for, again, working with us as we enter another school year in the midst of a pandemic. It's actually a little trickier this year. We felt like we had a pretty solid plan last year where we were able to have families that wanted to be remote, and other people in school and the rest of the students in school. I think overall it was a little bit more than 25% of our students were remote. Over 600, I think, was the number. And this year we're going to have a lot more kids in the classrooms. So guaranteeing any type of minimal distance between students is problematic to have all kids in school, which we're excited to have all kids in school, to have everybody back. But I know some families are uncomfortable. So we're working through the protocols. There's some similarities to last year, and there's certainly some differences. We look to be sharing those with the community by Thursday evening. Hopefully, that's our target. So people have a chance to look through those and ask questions in the days leading up to the opening of school. But the classrooms will be fuller. We have all of this. We are a little bit in a better place in regards to classroom air quality and mitigation. We have air purifiers in all the classrooms, and some of the questions that we had about, making sure airflows and things are a little bit over my head. But I know Bob Kuna and the people in the building that take care of those things have those ready to go, and so those will have windows open as much as possible for fresh air. So we're in a better place with air quality than we were going into last year. And the masks will certainly help, but the confusing part for us, and I know superintendents around the region are talking about this, is there's still some discrepancies between DPH and DESE guidelines. So we're working through that in regards to contact tracing. We'll be contact tracing according to the DESE guidelines, which any students within 3 feet of a positive student will be considered close contacts, and families will be notified in that regard. I think a question we have to ask ourselves is, will we notify parents within 6 feet, even though those students can stay in school? So I think that's a question that we're dealing with. The buses, as people know, is a federal mandate at this point in regards to masking on buses. So hopefully there'll be no confusion about that. We're talking to our bus drivers. If a student is getting on a bus without a mask, they'll be offered a mask. If they don't put the mask on, then they'll be asked not to ride the bus that day. And in regards to, again, we're hearing, some people asking about what if a student shows up without a mask on. Again, we'll have masks available to students as they're coming into the school. And if they don't want to put the mask on, then again, with the mandate, especially with the statewide mandate right now, they will not, be allowed in the building without a mask. So I know there's a lot of questions. We just actually sent the protocols out this evening to our building principals for them to look through them and ask questions. And like I said, once they ask some questions and we discuss those, the protocols tomorrow, we will be sharing them with the community on Thursday evening. And I'll make sure I share them with Susan tomorrow morning or even this evening as well. I think she may have seen some of them, but I'm not 100% sure. And we just appreciate the ongoing conversation where you can ask questions to us in regards to your, explicit knowledge of the DPH guidelines and make sure we're clear on decisions we're making and where we're within those guidelines and where we're not.
Thank you very much.
Does anybody have any questions?
Yeah, I have actually a comment, and then.
I have a number, sure.
Yeah,
Go ahead, please.
So, Mr. Larkin, thanks for coming and your openness to repeat coming back. I'm sure it's not your favorite thing to do is come in front of the Board of Health, but we do appreciate the collaboration from the schools. And I have to say, we entered last year in a really difficult environment, and I thought we really together, but particularly you guys, the ones that had to manage it, really did a great job in getting through a very difficult school year. Wasn't without issues, wasn't without hurdles, but certainly did a great job. So I just want to commend you and your team for doing that. And I think we were all hoping that we weren't going to have to deal with it again this school year, but unfortunately we're back here. So thanks for the time and efforts around that. Again, I know it wasn't with a lot of hours put into it. A question, so you mentioned about, there's a lot of differences for last year. Curious about, you mentioned remote learning. Is that an opportunity still for this coming school year? And how is that going to be managed? And then again, I bet you're going to have many more students in school this year, which is probably a good thing. But how are you managing classroom sizes and those types of things?
Yeah, I mean, we're definitely excited to have all students back, but with that, I apologize if you hear a barking puppy in the background. But with trying to manage that, there are more kids in classrooms. So again, we're fortunate in Burlington where class sizes are always, average lower than most other districts, but we still are seeing, 20 in some of the upper elementaries, low 20s in middle school. And the Department of Education has not, remote learning is not an option. They've told us that remote learning would not count for time on learning. So for middle school and elementary, there's a 900 hours kind of minimum requirement for student seat time. Some of these kind of outdated terminologies, and 990 hours for high school students. And it's unfortunate that there's such inflexibility because we do feel like, again, while we're not saying it's better than in person, if we do have to close a classroom because we have an outbreak, particularly, we're obviously very concerned about unvaccinated students, which is all of our elementary students. It seems, kind of unreasonable not to be able to do remote learning. So again, that's a discussion I'm sure we'll have in the days ahead. I'm hoping we won't have to even consider doing it, but I think, if a whole class is going to be home, whether the Department of Ed's going to count it or not, I mean, we'd be tempted to do something from our end. But again, this is all speculation at that point. And just to your original question, to reiterate, the Department of Ed is not allowing remote learning as an option on snow days, on closed classroom days, on any days.
So good luck. We're here to support you.
I think if we could see a copy, I guess, Susan, you're going to get a copy of the protocols before they go public.
Yes.
That
Yeah.
would be great if we can
I
share
can,
with us.
I can share that, I'll share the joint memo too that was
That'd be
sent
great.
out. I haven't gotten all the copies of their protocols yet. Patrick did mention the 3-foot, so it's a little
Yeah.
bit different, than last year. Because that is a bit concerning in that, if you're in school, it's gonna be 3-foot distance, but the number that we use for contact tracing is 6
6
feet.
feet still, yeah.
So if a child is in school and they're like at 5 feet, they would not be considered a close contact. However, if they're outside of school and it happened, say, in a dance class or someplace else where they were and they were within 5 feet, they would be considered a close contact. So I'm a little afraid that there's gonna be a lot of confusion around that with parents as to what is a close contact and what isn't. And parents are also gonna have to understand that, well, another thing in the joint memo is the option of doing a test and return type of thing, and I think the schools are still looking at that. I'm not sure if that's something that they're going to do, but if they did do something like that, children, can go back to school. If they test negative, they could go back into the classroom. That's the whole idea of it. But parents would need to understand that that doesn't mean that they can go other places other than school. So we're still doing case management, we're still following people, we're still calling everybody up, we do our communicable disease investigation, and we're gonna continue doing that. And this is just something that we're gonna have to manage a little bit differently and provide more explanation to parents as the difference between in school and outside of school.
Yeah, can I just follow up on that? Thanks, Susan. I think that's an important scenario that's going to be hard for people to wrap their head around. So honestly, I don't think I asked you this specifically when we met yet the other day on Monday, but so if we do our contact tracing in the school because of what you just said, you need to know who's within 6 feet because even though they can still come to school, which is kind of where this borders on confusing is one adjective. I'll leave it at that. They can't go anywhere else. They can't go to dance class. They can't go to youth sports. But they can come to school. So that's where, yeah, it's kind of head scratching sometimes to figure out why there's these contradictions in the guidelines.
Yes, and that's the way that I would look at it as well. And one other thing that is in what Desi has said today on the DPH phone call is that they can also.
They could go to after-school sponsored events, so if it's a school activity or school sports, they could go to that. So I fear there's gonna be a lot of confusion around that.
There's confusion now, and
More confusion.
I want to point out that this has been a true collaboration. I want to thank Dr. Conti, who I've spoken to many times, and of course, the assistant superintendent, who has been here and very supportive and helpful, and the school committee, chairman, Mr. Murphy, and also Ms. Monaco, who I speak to multiple times a week. There's been a true collaborative of getting our kids educated, but keeping them fully safe at the same time, and we're all in this together. So, and Mr. Murphy's here tonight on some other business, but thank you, Mr. Murphy. The test and return policy has already caused a lot of confusion, and have you decided whether you're going to adopt that process or not, or is that still under discussion?
Well, we've signed up to be part of it through the state, where we haven't done the trainings yet. So we have a little bit more to learn, I think, before we start to publicize that and let parents know how they would opt into that program. So that, I mean, we're leaning towards trying it, but I know we're not going to have this ready to go for August 30th. So I think our biggest concern, again, talking to Susan and just all of us, is what are we going to see the first couple of weeks? I don't know that we'll have this up and running. What are we going to see in regards to any type of spread within our schools? And if I know we're open to pivoting if 3 feet is ridiculous, like we're having 6 feet people become positives, and our elementary classrooms are our biggest concern. We're certainly open to adjusting on the fly. Our number one concern is to pay attention to the data early on and see if what we're doing is making sense or if more people are becoming sick with COVID.
Thank you very much. Are any of the other board members, any other, yes, Doctor?
So I just wanted to make a comment for our community. There have been a number of studies with regard to the impact of schools on COVID-19. And we know, as recently as this month, the American College of Physicians put out a paper in the Annals of Internal Medicine, which greatly reviewed the school issue. Schools are not the primary drivers of transmission of COVID-19. The risk of COVID-19 is greater outside the schools than within it. However, the schools do mirror what happens in the community. So when our chairman comments on getting vaccinations in the community, that is the main way in which we are going to quell this illness. So now that we know that the Food and Drug Administration has approved the Pfizer vaccine, it is no longer under emergency use authorization. We should feel increased confidence, I think, as our chairman also said, that the vaccine is safe, effective, and it will have a positive effect not only in the community, but also in our schools. And I just have two other points which I think are important to raise, and either our director or Mr. Larkin can chime in. But teacher vaccination, are all our teachers vaccinated?
No, but I know there's been a discussion at the school committee level, and I believe that all of the unions have been notified that it's going to be a condition of continued employment. So I think there's going to be a timeline there, but I do believe we're moving in that direction.
Yeah, I mean, all of the literature points to teacher vaccination, in addition to everything I just said. Teacher vaccination and regular asymptomatic testing are really the way to go. I don't know if we'll be able to do that, or if we are even thinking about regular asymptomatic testing, but it is something maybe we can think about. But once again, the schools mirror what's happening in the community. The schools are not the drivers of COVID-19.
Agreed. And we offered a vaccine clinic at the high school on Monday afternoon, and we're going to continue to do that around the district in the upcoming weeks. And we'll have the information posted on our website, and we email it to all of our families. Just for what you're saying, more people are vaccinated in schools, I think, the more likely we are to keep all of our classrooms open this year and keep kids healthy.
You know, obviously the kids who can be vaccinated, they should be vaccinated. There's more concern about high school students than there are about elementary students, and at least in the medical literature. And so knowing that high school students can be vaccinated is a relief. But I think that our community should feel much more confident in the vaccine and what we're doing within the schools. Thank you, Mr. Chair.
Is there anybody else who'd like to speak?
Is there anybody in the audience or online who would like to comment or ask a question to our professionals?
You had mentioned regular asymptomatic testing for what population?
I'm sorry, between the mask, the air conditioning, and my hard of hearing this?
Asymptomatic testing, you said regular testing of someone asymptomatic. What population was that referring to?
The kids.
Oh, the kids.
Kids.
You can do that. Okay.
Yeah.
Susan, do we have anybody online who'd like to speak?
So we have some people online. If there's anyone there, either you can unmute yourself.
Hi
Yes.
there. Can
Hi.
I speak for a second? So, Mr. Chairman, do you want only comments on the school stuff right now, or do you want comments on other issues as well? It looks like you have on your agenda that you're you might talk about sort of a town-wide mask mandate as well. Is that something that's
Yeah,
going to be discussed?
we'll be talking about masks a little bit later. This is Dr. Monaco. She's a noted pediatrician from Mount Auburn Hospital. I have spoken to her and thank you for coming. But please, if you have any comments, doctor, for the
Sure.
schools.
So I just have two quick comments. First, just for context, I'm a physician, I'm a pediatrician. I'm also a parent of 4 kids and a Burlington resident. And so 3 of my 4 are in the Burlington schools and 1 is preschool aged. So I'm thrilled with the progress that we've made on the state level and the local level to make sure that kids are masked in schools. And I just want to say thank you on behalf of both the physicians in the community and the parents in the community for your hard work on making that work. And sort of related to that, I wanted to comment that one of your members was just speaking about how what happens in the schools mirrors what happens in the community. And that is very true. And so, of course, in the pediatric population right now, we are seeing more COVID because of Delta. And so I think, in the schools, you're going to see Delta because it's in the community. And so one of the best things that we could do is really consider a town-wide indoor mask mandate in order to minimize the spread in the community. Because not only is that going to help the vulnerable of all age groups and just keep the community transmission as low as it can, but it's going to help keep the kids in school because they really are our vulnerable population. We can't vaccinate them. And if we can minimize our community transmission, then we're going to have fewer kids that get excluded from school because of either illness or exposure. So when you get to that in your discussion tonight, I would just urge you to consider a mask mandate, not just for the greater good, but also for the effect it will have on transmission to the pediatric population and therefore kids that get exposed or excluded from school.
Thank you very much. Is there anybody else?
If not, I thank you all for joining this evening, Dr. Conti and our assistant superintendent, Mr. Larkin. Thank you so much for joining us and updating us. As we have asked you in the past, we may ask you again to come on camera in future meetings because a number of people tune in and would like to hear from you. So thank you so much. I really appreciate for you being there. And with that, if there's nothing else, we'll move on. Thank you so much.
Thank you. Thank you for your continued support, all of you. Thank you.
Thank you.
Thank you.
Our next order of business is applications. Application for site plan approval, 207 Cambridge Street, Federal Investment Trust. And I'm assuming that our environmental engineer will be handling this, Christine Mathis.
Yep. And Susan, I think the engineer, Mr. Fred Russell, is on
remotely. Okay. I have the site plan up.
Great.
Okay.
So just for background, you may recall a few years ago, our Board of Health Department was receiving a number of complaints about icing conditions in front of 207 Cambridge Street due to drainage coming down off the hill next to the building and high groundwater table, et cetera. It was freezing across the parking lot and the sidewalk and freezing into Cambridge Street, impairing drivability at a certain area of the street. You have some of those historic pictures in your board materials. At that time, we did multiple inspections and worked with the applicant, which is Fidelity Investment Trust, and we worked out a tentative solution, or let's say drainage design, which was presented to the board just about 2 years ago. The design that you're going to hear tonight is identical to that design, but they're before you now, not for discussion, but as for approval for a site plan. So they've opened with the planning board last Thursday. They're getting department comments, including yours, for a site plan approval. I'll let Mr. Russell describe the design, but basically it's a retention basin that has an underground direct connect PVC pipe to the existing catch basin in Cambridge Street. There won't really be any infiltration on site because the height of the groundwater table. So it's mostly going to be a small amount of standing water, and then everything over that will flow into the catch basin in Cambridge Street. Because they are connecting to a drain structure in Cambridge Street, which is a Massachusetts highway, DOT's permission was required for access. They filed for and received a tie-in to the right-of-way permit for a direct connect from Mass DOT. It has since expired. They filed for an application, and I reached out to Mass DOT to get an update, and they indicated that an extension to that direct connect permit will be issued after site plan approval. So they're waiting on the town to finish to extend or readopt the DOT permit. So with that, I'll let Mr. Russell or Mr. Murphy, if he wants to add anything to my introduction.
No, that was a, good evening, Mr. Chairman. That was a very thorough summary by Christine, and I'll defer to Fred. He can explain the engineering aspects of it a lot better than I can.
Yeah, again, the record, Fred Russell, project deputy. Yeah, Christine, you did an exceptional job, basically summarizing everything. I'm not sure if there was any, if all the board members were present at that meeting, roughly about, I thought it was about a year and a half ago, Christine, where we came before you for the sort of this infiltration pond, if you will, that will have an overflow that will connect directly to Cambridge Street, the drainage system, which we did have a Mass Highway permit. That was, we had requested an extension back in July. It was set to expire in the middle of the third week of July. I actually filed for an extension on July 2nd. And at the time, the head of the permits division, who would essentially approve the extension, knew we were going for site plan review before the planning board and other departments, and suggested that, sort of gave a verbal that the permit will be extended. However, they wanted to wait and see if the other boards put any sort of conditions, or they may want to add more conditions based on the outcomes of the public hearings with the different boards in the town. And I reiterated that with, I actually talked to Christine today and spoke with the woman at the state that does the permitting as well today. So with that, basically the design you see there is the design that was approved by the board back about a year and a half ago. But because of the change in, not so much change in use, but change in occupants of the building, we're required to do site plan review with the planning board. Some of the other changes that have come up were, we really updated the plan as far as the detail that was required by the planning board as far as site plan review, as far as locating dumpsters, locating HVAC units, concrete pads. And one of the comments that came from staff was, as you're looking at the site from Cambridge Street, I've been sort of looking at it as the southern side, which is the side to the left, as the front of the building, and the northern side, which is the right side, which is sort of faces that hill. Part of the issue, which is why we proposed this infiltration pond, was that there's a lot of spring runoff that comes off that hill. And right now it's actually running up against the building and running down into the parking lot, and then causing the icing problem. On that right side, there are some secondary doors to the businesses that staff review. We had a staff review with a bunch of different departments, and one of them that came up is that we need to provide access to those secondary entries. And what we're doing is we're proposing to construct a crushed stone path for those access doors. And then essentially by doing that, we're moving the swale to the north or to the right towards the slope. We're just relocating that swale on that side of the new pedestrian path. And it will still function, and it will still go into that detention or retention or infiltration pond as we had designed. So that's probably one of the major changes or additions to the plan. Other than, again, some of the more detail with the dumpsters and HVAC units, AC units. And also, we provided a parking calculation to the planning board to show that the existing parking on the site now can support all of the new uses or all of the new businesses that are going in that building. And I believe that's it, unless Attorney Murphy would like to add anything that I may have missed or oversight my part.
Thank you, Fred. No, I think that covers it pretty thoroughly, Mr. Chairman. Obviously, we're prepared to answer any questions the board may have. Just two things I want to add. First of all, sitting at the table with me is Bo Santangelo, who's the property manager for this property. He's here on behalf of the building owner. Secondly, and it was kind of mentioned in passing, but I did want to point it out specifically. I was out at the site last Thursday. We had a first planning board meeting last Thursday, so I went up in the morning. If you remember, it was real heavy rain that day. If you go up to Woodcrest, which is the street above at the top of the hill, where it ends at you can see it on the plan if the plan went back a little bit further. It's almost straight uphill from that point for a good 300 or 400 feet. And there's absolutely no catch basins or any type of drainage at the end of Woodcrest. So the water just sheets down Woodcrest, eventually down the hill to the side of the building and out onto Cambridge Street. So that's the genesis of the problem we're trying to cure here. But I pointed that out at the planning board meeting last week, and one of the residents, butters who live there, kind of reinforced that and did make the point of saying that the runoff is starting to undermine the end of Woodcrest Ave. So it's kind of separate and apart from what we're doing here. We're hoping to treat the problem, but the source is something that at some point maybe the town should look at doing something up there. But like I said, I just say that parenthetically. The only other thing I just wanted to let the board know, we have seen and reviewed the proposed conditions. We've gone through them with my client, and Fred's reviewed them as well, and we're fine with all the conditions that the board is proposing to put on their decision.
Any other comments?
Nothing further.
Does anybody have?
Just one question.
Please go ahead.
So, well, comment first is that I'm excited that this is getting fixed. It's been a number of years, and certainly during the winter months, it gets to be a pretty treacherous sidewalk and walkway. The new tenants that are moving in, are there gonna be any changes to the exterior at all, like parking and, I'm just thinking that if we approve this plan and then you have other changes, maybe to grade or to exterior, that's gonna change the number of impervious surfaces or flow of water.
Prefacing it by saying we're just starting the review process with the planning board. There are no proposed exterior changes to the site. There is some aesthetic changes to the exterior of the building that the tenant is proposing. We're trying to address some issues with the site, dumpsters and things of that nature.
Yeah.
But there is no, at this stage of the game, and there's a general desire from the planning board, which my client is willing to do to the degree that we can, is to increase some green space here and there. Certainly no grade changes.
Gotcha.
And I don't foresee any structural changes that's going to change traffic flows or anything like that. But we might try to get some green space. For instance, in the area where we're putting this retention pond, there were 4 parking spaces there that are coming out. So perhaps we can dress up around there a little bit and get a little green space in there. So nothing, to your question, nothing drastic from a site standpoint, but just some aesthetic improvements.
Thanks, Tom. Is there an ETA when this might get done?
I'm guessing it's going to take another couple of planning board meetings before we finally get the permitting part of it wrapped up. I think O'Reilly's wants to get in there as soon as they can. Do you have a time frame on that?
We do not have a time frame on the new tenant.
They're going to be doing some internal renovations and also some interior renovations and also some dressing up. You know, end of the calendar year perhaps, maybe into the early next year.
Great to get it done before.
Yeah, I'm sure they would certainly like to get the outside done.
Sure.
Before the weather hits.
Great. Thanks, Tom. Appreciate it. That's it, Mr. Chairman. Thank you.
Dr. Salzman, anything?
No.
Gene? I have 2 questions. Question number 1 is, you saw proposed condition number 2, a fence or guardrail around the depression. It's really only a couple of feet deep, but we've had cars drive into them before. these types of things.
I know that's a common condition that the board, the only thing that, and we'll probably have to confer with the planning board on this from a aesthetic standpoint, what they might want in there,
Understand.
so we'll have to work with them on that.
Some
But-
type-
But there will be something there.
And the other question is, how long will it hold water? In a rainstorm that ended Thursday, can ask your engineer, please, how long will that hold water?
Based on the calculations I did, roughly about 68 hours.
68
hours, okay, so
it
really
needs
it needs some type of.
fencing around it.
No, we'll definitely do that, and like I said, it's more of an aesthetic question than a.
And is this, I'll ask our environmental engineer to comment, please, as a second question. Do we need to consider anything about mosquitoes if it's going to hold water for 68 hours?
Fred, I thought it was holding water less than that.
I can double check the calculations, Christine, but the soil conditions out there aren't very conducive to infiltration, as you know, when the water table is high. And I'm talking about extreme conditions in the height of spring, when the water table is at its highest and we get the spring rain and the snow melts. So that's more of an extreme condition.
But the overflow height is set at what height? Off the bottom of the unit?
It's about 2.5 feet off the bottom.
Okay, so it'll hold roughly how much water for how long?
Oh, so 2.5 feet. Again, I can, if I had a guess, you're probably looking at, well, bear with me.
I'm not concerned, this is not in a residential area, so.
Yeah,
it's-
probably maybe 1,000 gallons. And again, that's the most it will hold. And again, when you look, I'm talking about extreme conditions in the spring where the water table is almost at the surface, so very close to the surface, and you get the spring runoff with rain and snow melt.
Director,
In the middle of summer, it could be dry for periods of time, and if we get a rainstorm, it would be a lot far less than that in the summertime.
So I'm looking at the drainage report, and it says during a 100-year storm, peak storage would be 14 cubic feet for 12 hours.
Correct, but that's above the of the outlet.
Okay.
Above the what, outlet, he said?
The outlet to the.
Above the outlet.
Director wants to make comment?
So just in regards to your concerns about mosquitoes, the average time for mosquitoes to breed in standing water is 10 to 14 days. So even if it went to that 60 hours or how many times you said, there wouldn't be enough time anyways for the mosquitoes to breathe in, unless I suppose it rained and rained and rained and rained, and then it was, standing water for 10 to 14 days.
So you're not concerned about it?
No.
Okay, thank you. I guess my professionals answered. Thank you. If there are no other questions, do I?
Mr. Chair, I'll make a motion to approve the application for site plan approval 207 Cambridge Street, Federal Investment Trust.
Second.
I have a motion by Mr. McSweeney, second by Dr. Saltzman. Any other discussion? Anybody here? Anybody online? If not, I'll put it to a vote. All in favor?
Aye.
Aye. Opposed? 4-0-0. Thank you very much. Thank you very much for coming. Hopefully, we have a solution to a long-time problem.
We hope so also. Thank you, Mr. Chairman, members of the board, and putting my other hat on, I want to just echo everything that Patrick said. You guys have been great to work with, and hopefully, after we get by October 1st, and things will slow down a little bit.
Thank you.
Thank you all.
Thank you.
Thank you.
Good night. Did you both sign in?
I did.
Yeah, please print your name so we can get it right. Mr. Murphy is chairman of the school committee in the town. So we don't want to go afoul anymore. So I have 1 Liberty Ave, keeping of chickens.
Susan had a comment, I think, Mr.
Ju-
Chairman.
I just wanted to remind you, we do have some other people on the line, and I don't know if they were here for citizens' time, but during citizens' time, they couldn't hear, so I don't know if anybody had a comment for citizens' time.
Could you just wait one, if there's anybody who's on the line who would like to make comment now on something that is not on the agenda, since we had a technological glitch, feel free to speak up now. Unmute yourself.
We're good, no one.
Thank you. I guess we're okay now. I don't want to lay an egg, I'm sorry.
If you guys could sign in, that'd be great. Thank you.
And please print your name, although I think we have it. So the applicant information is Lynn Chia, is that how I would say it?
Yes.
And who is who? You are?
I'm Warren Chia.
You're Warren, you're Lynn. Thank you, Warren. Who is handling this?
So Samantha Hardy did the inspection there, and she had no issues, no concerns. She reviewed all the information that they gave us, and we haven't had any calls or any issues or questions or anything from any of the neighbors. So we did notify all of the direct abutters.
Yeah, I saw that there. So would you like to tell us what you want to do?
Yeah, we would like to provide a big, happy home for 6 girls, and they'd just be, for eggs, they're not to eat. And we want to just have them in our pasture or fenced-in yard. It's about a ½ acre of very usable grass and a nice retaining wall of garden veggies and lots of bugs for them to dig around in, if possible.
And the waste material, as I can say,
Yeah.
what do you do with that?
So on the opposite, so this is, on one end, this is where their coop would be, and on the total opposite end, on the main street side, away from all our neighbors, there's a pallet compost bin that we've set up, and all the manure goes in there.
Thank you very much. And no, as you said, no roosters.
No, I
No
could
roosters.
not, no, too loud.
People like to sleep.
Yeah, for sure.
Are there any other questions? A beautiful coop.
Yeah, it's a great looking coop.
Yeah.
You have a lot of experience in this, or any experience?
A lot of Pinterest boards and a lot of Instagram posts that I follow for inspiration.
Well, you are not alone in this town. There's quite a few people who
Really?
keep chickens now, so.
I wish there was like a Facebook group or something for Burlington. I'm on the Dedham group one because they're so passionate about it, but in Burlington, we don't have one yet.
There is one for Burlington.
Really?
A Facebook page, yep.
For birds? For chickens?
Oh, well, for Burlington in general, but I've seen chicken postings on it.
Yeah, I mean, just like for like special interest people like myself who really, like, I don't want to bore people on the Burlington residents page about my chickens and my breeds, but I would love to get in touch with the other owners.
Anybody other question? Machine, any question? Well, first of all, thank you for coming.
Of course, thanks for
And,
having us.
It's exciting.
Yeah.
So do I have a motion to approve?
Motion to approve.
I have a motion to approve, Ms. Sheehan, second by?
Second.
Second by Dr. Saltzman. Is there any other discussion? Anybody online? Abutters or anybody comments? If not, all in favor?
Aye.
Opposed? 4-0.
So we will send you out a permit, and it's for a year, and Samantha will be in touch next year for another inspection.
Thank you guys.
No, I'm
That
sure
was
we
easy.
won't have to pull it.
Okay.
So-
No, very clean.
Thank you so
guys.
much for
Good luck.
coming.
Thanks for coming.
Thank you.
Take care.
Okay. Since we have already discussed the schools, and let me just get my stuff in order here for 1 second. We go on to masking in the community, and I want to get the, there it is. I want to get the exact COVID-19 and facial covering advisories and mandates. This is a complicated and confusing topic. I know our director can give us a little bit of an introduction here, and we can talk about it.
Okay, so we've been getting quite a few questions from people. Not only is Burlington going to implement the mask mandate, but, there's a difference between the CDC mandate and the DPH, well, the CDC recommendations and the DPH recommendations. And I've included that material in your board book, but basically the CDC is saying everyone should wear masks indoors in an area of substantial migration, and there's also some information in your board materials on that as well. Basically, Massachusetts now is, majority is substantial or high migration. So the Department of Public Health has said that we're not going so far as that, to say that there needs to be an indoor mask mandate, because our vaccination rates are higher in Massachusetts than in other states. So the DPH feels that we don't need to go as far as what the CDC is recommending. I don't know if that's going to change as time goes on. They haven't given us any indication or when that might change, or what number they're going to get up to for percent positivity, or whatever number they're going to use to implement a change in that. So I've also included information in your board book about other cities and towns that have implemented a mask mandate around us. That includes Winchester, Billerica, Lexington, I believe Wilmington now has. So those are the communities basically surrounding us that have implemented the mask mandate.
Thank you very much. Well, I'll open this up to the board. How do you feel about this? Is this something that we want to study for the next meeting? Is there something that we want to talk about tonight? Is there something that that you want to bring? I'll ask any of the board members to comment. I have some questions around that, specifically around enforcement, which is the issue. Some of the communities had specifically listed indoor places that should have them and have not, and we haven't looked at that either. And how do we feel about the town buildings? So there's a lot to consider here. And lastly, it has to do with responsibility too, which is a number of people have brought up. So these are all issues that I just want to bring forward in the comments. So with that, I'd like to know how you feel about it, as well as the board members, and where we should go, and where should we go with this tonight? I know we have a number of health professionals here, online, and professionals in our community on the board of professional board of health employees, and our director and an environmental engineer. So, does anyone want to speak? Would you like to speak to the, yes?
I just have a question, Susan. When we look at these other towns, comparatively, are we like so much lower? Are they so much greater that they felt the need to implement that now?
So I would point you to the Massachusetts DPH data tracker. If you go to the Board of Health website, go to COVID-19, and then go to data, you can actually look at every single city and town and look at the different types of data metrics. So, I mean, and I'm sure Dr. Saltzman can add to this as well, but I think it's going to depend too on what data metrics they're looking at, and I'm not sure what each one looked at in making their decisions. I didn't, closely review all the meetings of the different boards of health to see, what their reasoning was for doing it. But if the board members want to take a look at that and look at the data metrics, the different data metrics for Burlington, that data tracker is a really excellent tool to do that. And you can also see the trends that are happening in the state overall with regards to it. And it talks about there's not only data for positive cases, but also data for vaccination rates. So we can really, boil it down to a lot of different data metrics by looking at that. And then just to add to what you were saying, I've looked at a few of the different cities and towns and how they did it with regards to the orders themselves. Some of them have been very specific and saying, where it needs to be in restaurants, it needs to be in gyms, and have kind of named out the different areas where masks are mandated. Others have just said in public places. So I think that that's, if the board is gonna consider this, there's different types of wording that you could have with regards to how you wanted to word something like this as well.
So I haven't been on the DPH site in the past number of days, but they're still advertising counties, and, or have they gone to towns now?
They do have towns.
Yeah.
So if you go on the side, it says city and town data. If you click on that, and then go to Middlesex County, it will list all the towns of Middlesex County, and you'll see Burlington there. I can look it up real quick if there's numbers that, specific numbers that you're interested in looking
Just
at.
came back on the website now, but, you know, I would just say, not as a physician, but as a citizen, you know, I do have faith in the CDC. The head of the CDC is the former chair of infectious disease at Mass General Hospital, and is extremely qualified. I trust what she says and the organization that she has created. You know, I'm on the CDC website right now, updated August 19th. Is the information we have to the board through August, up to include the August 19th update?
For,
CDC. The information the board has.
the information that
Yeah.
I provided you? No, it's
Yeah,
not,
I
it was
didn't think
last
so.
week.
Yeah, I didn't think so. Yeah, so the current information is to wear a mask if you're vaccinated, to wear a mask in public indoor settings. If we're in an area of substantial or high transmission, we are in an area of substantial transmission. You know, fully vaccinated people may choose to mask regardless of the level of transmission, particularly if they are, or someone in their household is immunocompromised, which mirrors the state. So, Mr. Chair, I would feel comfortable, given the information we know today, to have an advisory for wearing masks for vaccinated people. I just don't feel comfortable, but I would be willing to have further discussion regarding mandating mask wearing, largely for the reasons you've elucidated, enforcement, et cetera. But listen, we've been doing this now for a year and a half. This is part of our lives. This is who we are. The best thing we can do is be vaccinated. The best thing we can do to further mitigate is mask and distance. But I believe that having an advisory and having, you know, the good citizens of this town follow that advisory is the way to go. I personally would not recommend, or cannot recommend to this board, mandating, as I don't think that we are there for that. But an advisory, I would entertain. I defer to my colleagues on the board, obviously our Director of Health, but that's where I am today, given what we know. And as you can see, I'm wearing a mask. So, practicing what I'm preaching, but it's my choice to do so, and I am vaccinated.
So, a couple of comments. I think, so you started out the conversation, Mr. Chair, asking, you know, should we have this conversation? And I say, absolutely, that's our job, right? I mean, I think that's the reason why we're elected onto this board, is to make sure that we're constantly talking about these types of things, not just necessarily as it relates to mask wearing and COVID-19. You know, it's funny because, you know, you know, kind of, you know, tangential to what you were talking about is I walk into any store now, whether I'm in a, you know, a different town or in the city, and I'm always looking to say, do they have require a mask here? Is there not a requirement? So it's become a way of life. And, you know, as Christine and I were talking earlier, I'm back traveling for work again, and everybody's used to wearing a mask at the airport. So I think there are situational ways to look at this. And I don't know what that is. I don't know where you draw the line or how you draw the line. You know, I agree with Dr. Salzman that, you know, I don't necessarily favor a full broad mandate for mask wearing in the town of Burlington. But I do think it's healthy conversations to continue to look at this. understand what the town's doing. Also, too, we have to realize that whatever we implement, we have to manage and monitor it, right? And that's always, it's easy to be said that, yeah, we have a mask mandate in town, but I don't think people realize, we do, what goes into having to monitor that. And so I'm not saying that should be the deciding factor, but there's certainly, other things to consider to ensure that we're not putting the public safety at risk at all. So I do think we should continue to have these conversations, in this particular conversation, at future board meetings. I like the advisory. I think I probably would be in favor of that, of recommending or advising mask wearing. But, I think if we're going to make a mandate, I think it should be situational, just as everybody who travels on planes today has to wear a mask. I think there's certain situations that are a little bit, in schools, right, they're a little bit more risky than others, and I wouldn't necessarily as well support a full mandate. Thank you, Mr. Chair.
Thank you very much.
I agree, that's good.
I want the town to understand, and why I brought all the issues to the forefront is, that's a lot of issues that go into a mask mandate. We want to keep this community safe. And I would like to offer a couple of things. First, I'd like to set up a subcommittee of myself and Dr. Saltzman that we can speak prior to or during the time between meetings and discuss changes, and if necessary, if things go bad, that we need to call a special meeting if necessary. The second thing I'd like to ask is that on our next Board of Health meeting and in subsequent meetings, I would say through October, that we keep this as an agenda item and we look at it every single meeting. And Dr. Saltzman and I and the subcommittee, the two of us will be a subcommittee, and we will talk about this and report to the board at each meeting through October. Dr. Saltzman, would you?
Oh, no, I'm delighted to do that, Mr. Chair. Thank you.
Thank you. And if we need a mandate, we'll have a mandate. And if we don't, we won't have a mandate. But we need to talk about responsibility. Everybody has the responsibility, not only to themselves and to the public, for their family, their friends. If you're fully vaccinated and you're not wearing a mask, you can still spread this variant this far. This is a very responsible community. This is a community which is pretty smart, and they understand it. And as Dr. Saltzman said, we have been going through this for a year and a half. A good year and a half, and we've kept this community safe, and we'll do what we have to do. So I do like the recommendations. I hope you agree with my recommendations. If you'd like to add anything, please add it, and if not, we will revisit this at our next meeting.
Okay, I think that's a great idea, to have the subcommittee and to kind of keep looking at this issue and bringing it up as we need to.
Thank
Yeah,
you.
Mr. Chair, you've as you have done throughout the entire pandemic, you have made this an active issue because we really have had to do so. But it can't. We need the community voice. We need the community to be part of this. We need to hear what the community has to say. I don't want us to be up here. Once again, I'm a physician, but I'm on this board as an elected citizen. So I have the ability to speak both languages, but I'm here as a citizen advocating for my fellow citizens. But we need this town to play a role too and be as active as our chair is promoting. So please, give us feedback, let us know what you're thinking, so together we can make an educated decision about what is next best for this town. I think that's crucial, Mr. Chair. I really do, and I think that's the best way we can advocate. And I laud you and our board and our staff for being as thoughtful and proactive and appropriate in this area as we have been for every other area that comes before the Board of Health. Thank you.
Thank you. Is there any other comments from anyone online or anyone here? If not, we'll go on to. Sure. Your name, please sign in.
Sure.
Please print your name when you so.
Yes, I will.
Thank you.
My name is Deborah Glancy. I'm a town resident, and
Could I beg you, with this air conditioning and my hearing loss, can you speak into the microphone? Because it actually amplifies your voice.
Wonderful.
Thank you very much.
Hi, my name is Deborah Glancy. I'm a member of Town of Burlington and also a member of the UCC Burlington. And I can appreciate the idea of having an advisory, but there needs to be more education. There are a number of members of my church that do not seem to really understand that they're vaccinated and they are at risk of reinfection and asymptomatic spread. And I agree, we have very smart people in our town, but the information throughout, our world really, and our country it's disparate. And so I encourage us, if we're going to do an advisory, we also give some good education and a consistent message. That would be my request.
Thank you very much.
So I think your point is very well taken. I am saddened to hear a year and a half in that we still need education on this, but it's a reality. But you bring up a point I'd like to address, and I thank you for it. Social media is not truth. I sat next to went to a restaurant, we all wore masks, sat next to somebody who said, I learned that getting a vaccination was the worst thing that I could do. Because now I can't give blood. Now my RNA has been changed so that if I get a cold, I'll become as sick as if I had gotten COVID. And it took everything in my power not to stand up in the middle of the restaurant and just say, seriously? I agree about education, but getting back to what the chair said, I agree. I also want to promote responsibility. We have a responsibility to become educated and do so appropriately. I will be the first one to volunteer to do it. But we need to have responsibility from those individuals you're talking about to actually want to be educated. For those individuals, the worst thing we can do is mandate, because they'll feel as if their liberties have been given up. So education plus the advisory right now is the way to go. And then if we have to go to a mandate under situational reasons, people will understand where we're coming from. But I would urge your folks to become educated. And if there's an interest at your church, contact me and I'm happy to come speak. I'm not an expert. I'm just a guy who has been affected by this in more ways than you can imagine. So I'm happy to help. We all are.
Wonderful, thank you.
But there has to be a responsibility on the part of our citizens to become appropriately educated as well.
Agree. I agree there needs to be responsibility, but it is a matter of giving clear education from authoritative sources.
And there is stuff on our website.
Yes,
Yeah,
yeah,
I was
we
just
have
about to
on
say
the
that.
left-hand side of our website, COVID-19 tab, and we've got everything there.
And if it needs to be digested more, then we're happy to do that. Granted, the CDC is coming out with new stuff all the time. It's frustrating and confusing, even for me. But it is a source of truth. But if the community comes back and says, we appreciate what's on your website, we don't get it. Can somebody digest it a little bit for? Yes, I'm happy to ruminate for that with you. And I know plenty of other people who are too. So let us know. Let's keep the conversation going.
Wonderful,
Okay?
thank you.
Thank you very much.
You're welcome.
Thank you for coming.
Thank you.
Okay, we'll go on to staff reports.
We have, I don't know if there's one other person online. I don't know if they want to speak or not. I guess not.
I did ask,
Okay,
yes,
yeah.
please. Let's go.
They can also they can put it in the chat too if they have a question too, and
I'll call the Board of Health.
Yeah.
Feel free to call the Board of Health at any time. Environmental engineer, staff reports.
Good evening again. I just wanted to remind everybody that household hazardous waste is September 18th, Saturday, September 18th, at normal place and time, Francis Wyman School, 41 Terrace Hall Ave, begins at 8:30, ends at noon. Our website has a full list of what you can and cannot bring. And again, feel free to call us if you have questions about what's acceptable and what is not acceptable.
Thank you. Number 60 for me. Yes.
I have a question, and I think Mr. McSweeney will appreciate it. It has to do with a water issue elsewhere. So after last week's rains, I needed to go to Staples. And so I drove past the area that's in front of Wendy's and all of that. The water was horrendous there. Still, how many years have we been talking about this?
Probably close to 2.
So do we have any, so there's a retention wall, and then there is marsh area behind that, and that was completely filled with water. So I definitely get the issue that's going on there. But the water was horrendous. And I can only imagine what it was like this morning after the recent rains. So is there any movement on that, Christine?
Susan has the most recent update on that, if you.
I
Is
thought
there
they
any
started
movement?
it.
Director?
I thought they started it.
I was there,
So
I was
we
there
did-
yesterday.
We did, and so we wrote a nuisance letter on them, and we have been working on this for quite some time, as you know. Christine was working with them on, they needed to do some work to the detention basin, and they did that. And, but that didn't solve the problem, obviously. And, so they have come back to us with saying what they were saying before, which was the problem is because of the levels of the brook, and it's on the town, and so they have given that to us. I have given it to town council, and I am actually meeting with town council in the beginning of September to try to get some more answers on how the Board of Health should move forward with this. Town council has said, really hasn't, they need to give us some more direction on how to move forward with enforcing that order letter that we had given to them. They were working on it, and then after they finished the initial work, a basin that obviously was not solving the problem, it's something else. We don't know what it is. Maybe it's, the pipes. They need to investigate it more. So we need to get back on them about doing that, and I think we're gonna need town council for that.
Can we ask them to come in front of the board? It's been 2 years since we've been talking
Yes,
to them.
so that was my next step.
Going on for 4 years, probably.
It's been
Yeah.
going,
I don't know if it's
I
been
think
that
they
long.
owe the community
I agree.
a discussion.
Yeah.
It's just, it was, the flooding was horrendous, and then I'm channeling our chair, who's thinking about, as we all are, the safety, and I'm just thinking about the number of kids that go through that area on bikes, et cetera. It is just not safe, and so
What day, so were you there, was it last week on
it was after it was
Tuesday?
not, it was it was after the
Or
rains
Thursday.
of last week, but before the rains of this weekend.
Yeah, Thursday, that's the day where
I was thinking of a different
I will
puddle.
say there was flooding all over town, because I was out driving around on that day as well, and there was many areas that were flooded, but that, if we go out there again, probably this week, we'll see that large puddle most likely still there. Maybe not as bad as you saw it, but I'm sure it'll still be there.
it is there all the time.
Yeah,
It is
so my plan was to meet with town council, I think it's September, actually, it's the first week in September, and then bring them, hopefully to a September town meeting with help from town council.
Thank you.
I guarantee you, the town didn't change the marshlands that are there. So if there's a drainage issue, they need to fix it.
What they're saying is, that the issue is with the level of the brook, that the brook has gone up, and therefore there's nothing that they can do about it because Vine
fix
Brook has risen. But either, yeah, and.
I think that they need to come and they
We
need
need
to.
to have, and we need to have, and I've given that to our town engineer, and they disagree with that, is what they're saying, so, yeah.
Well, even
But
if-
we will
even
bring
if-
them
Oh,
forward.
I shouldn't even say that. I was gonna say, no, forget it.
And on the
Not
subject
on
of the other
record.
puddle, I know that you visited the other puddle too. I was the one I was talking about on that we had a board meeting there, and I know you've been there 2 or 3 times, and thank you for doing that. I'm not going to ask you to report on it right now because we have a major meeting coming up, the first meeting in September, but thank you for keeping an eye on that.
Sure.
I've been out there 2 or 3
Yeah,
times.
I popped by on whatever day I told you I did.
Okay.
I think it was Thursday.
Yeah, Thursday.
Are there any other questions for our environmental engineer? If not, I'll ask for a motion.
Motion to approve the environmental engineer report.
Dr. Salzman, second?
Second.
Second. He beat you to it.
Yeah.
Okay. There we go.
She can have it.
No other discussion? All in favor?
Aye.
Aye, 4-0. And then, Director of Public Health. Now, as I've said before, the Director of Public Health's report includes the health agents, the Associate Health Inspector, and the supervisory nurse. So, and then her own report. So I'd like to take the health agent, associate health inspector, and supervisory nurse. Are there any questions on those 3 reports first? I have one. Lacasia's DPW found fog, fats, oil, and grease, Dr. Salzman, in the sewer line. Did they figure out what's going on there?
Yeah, so there was a large blockage along their line. Department of Public Works, John Sanchez gave me a call to let me know about it. Marlene went down there, took a look at it. They were having some issues with, and had fixed it or replaced it. So we think that's what had caused the problem when they replaced it. Maybe the previous one wasn't working, but we think the problem is solved now.
Thank you.
Gosh, I hope so.
Are there any other questions? I have one other, and that is 7 Town Line Road Housing, an illegal apartment.
Yes, so that was something that we worked on with the building inspector, the building department. That's illegal apartment, is not always within our purview.
That's why I was going to ask.
Sometimes if it's an illegal apartment, we'll also find violations of the housing code. In this case, we didn't find that, but when someone calls and tell us, I have an illegal apartment, we always go out and do the inspection with the building department because they have purview over that, and they take it over from there. So it's really, that was mainly just a referral to the building department because we didn't find any housing code violations during our inspection.
Thank you. Did the tenant of that illegal apartment, given some time to move out, I want to be
Yeah.
sensitive to.
Yeah, so they were already planning on moving out anyways. That's usually how it works with someone when they call themselves to report that their own apartment is illegal. They're planning, or they already have someplace else to go.
Okay.
So that was what happened in this case.
Thank you very much.
Can you remind everybody about when our flu clinic is going to be? And then I have a statement about that.
Yes, so that is October
I think it's the 16th.
16th. Okay. Yes.
October 16th, a perfect time to get your flu vaccination, actually ideal. As our director may already know, the CDC has recently changed its guidance on COVID-19 vaccination and other vaccinations. There is no longer a specific timeline between the two. Had been 14 days, that has been rescinded. So in the interest of folks now looking at a 3rd dose of COVID-19 and perhaps worrying about getting a flu, when they can get a flu shot or if they should, you can literally get a COVID-19 shot, vaccination and a flu vaccination on the same day. There's no more restrictions. So if you're concerned about October 16th because you need to get a COVID-19 vaccine on the 14th or on the 20th or whatever, and you shouldn't come to the flu clinic, you absolutely should. Please, please come.
And then also on the flu clinic, just so the board knows, there's gonna be a lot of changes than how we've done it in the past, because now we have the ability to use the software to have people sign up ahead of time. So we're going to get that messaging out, but what people will do is go on to the the web and sign up online for a time slot to receive their flu vaccine. And we'll have that all set up, and then they come during the day. We check them off all electronically, so there will be no paper. So before we had the copiers and the papers, we won't need that anymore. We're gonna be using iPads, so everything will be done electronically, and that's great. So we were using PrepMod software, which was for the COVID vaccine. The state is changing that to what's called ColorWorks, so we're gonna be using this color software to do the vaccine clinics. So we're all learning that all staff is starting to learn the new software and get up to speed on that. So we have a lot to get up to speed on before the clinic, but we'll be there by October, and I think it's gonna be a lot easier on the residents because they'll know what time to come. There won't be crowds of people. You'll have a time slot. People hopefully will come in on their designated time slot. That'll reduce the crowds, so we won't have to worry about that as an issue. And of course, we'll, try to space people out. And hopefully we have a lot of new MRC volunteers. Hopefully we'll get those new volunteers to come and dispense. And the plan is to get 16 dispensers at once. And I've kind of lowered the time frame for it. So before, when we were kind of there all day, I changed the schedule a little bit, got rid of the lunch, and hopefully we'll have more dispensers so we can get people more in there quicker and more people, and then kind of condense the time. So that's the plan for this year. It's so new every year, so hopefully it'll work out well.
Thank you.
I mean, the Southern Hemisphere has, continues to report substantially low flu vaccine, and we get our information from them. I think a couple weeks ago, Australia had like 50,000 flu tests and 1 positive, that kind of craziness. Regardless, it is crucial, please, everyone, if you can get the flu vaccine, please do it. Oh, by the way, if you can get the COVID-19 vaccine, please do that too.
Good.
One more thing I just wanted to bring up on the code red, because Dr. Saltzman brought this up, I believe it was at the last meeting.
Is this part of yours, now that we've gone through the first 3? This is now your report?
Oh, I'm sorry, go ahead. No,
Okay.
no.
Now it's your report. We've evolved.
Yeah, now it's mine.
Transition.
Unless there's any other questions.
It was great, it was a great recommendation. It's in my cell phone.
Oh, good.
If I get any of those phone calls, it's gonna come up by their code red or what the other code is.
We hope.
Something else. So it was a great recommendation, and thank you very much for taking it, for being so proactive on that.
Yeah, and we'll do another drill, make sure it works. And I also want to do a text messaging drill, so we're going to be working on that too. So we can
Try
get-
not to use the one that the town uses with the electronic voice.
No, we use Sarah's voice. That's
Use
Sarah.
Sarah's voice. I mean, did you get the one? Yes.
Yeah, the electronic voice.
It sounds too much like a scam. Anyway. Any other questions for?
Oh, one other thing. So I just wanted to remind you, Mr. Chairman, about the small cell advisory.
I will speak to Ms. Sheehan afterwards. Thank you. All right. There are no, do I have a motion to approve the Director of Public Health reports, plural?
So moved.
Second.
I have a motion by Ms. Maswini, second by Dr. Salzman. All in favor?
Aye.
Aye. Opposed? 400. Is there anything else? If not, I'll ask for a motion to adjourn.
Second motion.
No, make the motion.
Okay, I
Please,
motion to adjourn.
Is there a second?
I'll wait a second.
Second by Dr. Salzman. All in favor? Aye. Good night, everybody.
Night,
Have
be
a good
safe.
evening.
Be safe.
And for those who are Jewish in our community, I wish you Happy New Year.